Hello, I'm Pablo Espada, and I would like to comment with you the results of the ODYSSEY outcomes trial. This is a trial with Alirocumab. Alirocumab is a PCSK9 inhibitor. The trial design was in patients with 1 to 12 months out from an acute coronary syndrome event were randomized in 1-to-1 fashion to Alirocumab every 2 weeks subcutaneously or placebo. The drug was titrated to keep the LDL cholesterol between 25 and 50 milligrams per deciliter, but always above 15 milligrams per deciliter, and the patients were followed for a period of 48 months. The results were that the primary outcome, this is MACE, major adverse cardiac events, Alirocumab versus placebo, 9.5% versus 11.1 with a p-value of 0.0003, and the patients who benefit more were those who had an LDL cholesterol more than 100. Coronary death or cardiovascular death or for coronary heart disease were 2.2% versus 2.3% with a p-value 0.38, and all-cause mortality was 3.5% versus 4.1% with a p-value of 0.026. MI 6.6% versus 7.6%, p-value 0.006. Stroke was 1.2% versus 1.6% with a p-value 0.01, and unstable angina 0.4% versus 0.6%, p-value 0.02. There were two arms, Alirocumab or placebo, more than 9,000 patients in each arm, on top of statin and maximal tolerated statin dose. They was very critical patients because they were having an acute coronary event in the last year. And it was a landmark trial because it indicated that the use of Alirocumab every 2 weeks significantly reduced the ischemic events, including all-cause mortality and MI, among patients with acute coronary event with the preceding 1 to 12 months, and 90% of them were on high dose of potent statin. It means rosuvastatin or atorvastatin. And the cost-effectiveness analysis important for this expensive medication was that cost-benefit ratio may be favorable in patients population with LDL more than 100 milligrams per deciliter. Thank you very much.